Woo! Okay, here we go. Well, this is a first. All right, let me see. Wait, what? That's not what we're doing today. Let me go back. Okay. Now let's see how we do this. All right, y'all. I have some people coming in. What's up? What's up? Welcome, welcome. Happy Sunday. What's today? The 16th? We're halfway through this month. Yeah, like halfway through this month. How y'all doing? How's your October going? Are you in nursing school or out of nursing school? How y'all doing? Let me know. What's up? I'm Nurse Sam for anyone that does not know me. Hello, hello. Founder and creator and CEO of Nurse Sam Global Media. This is where I create creative nursing school study guides and resources for RN and LPN nursing students to help you guys get through exams, get through nursing school, that whole overwhelming process. So you can go ahead and review for the NCLEX, pass it, and become great and amazing nurses. So I started doing these lives pretty much every week to help you guys, to help the transition from summertime into nursing school or back to nursing school, depending on which semester you're in. So let me see how y'all doing. Hey, shot caller, Malika in nursing school, whoop whoop. Just got through your first semester, shot caller. LY Pink, how you doing? I passed my nursing exit. Was it? Ooh, congratulations. I am Angie. Awesome. Congratulations. Okay. So I'm just going to put up with what we're doing for today. All right. So if you guys don't know, this is week one. This is the end of week one of our NCLEX Trick or Treat extravaganza. And that's just, y'all know I love my themes. I'm the queen of themes. I'm a visual learner and a kinesthetic learner. So I love for my content to be creative yet still educational. And that's why all my study guides and my resources and my methods went viral. Because when I was in nursing school 8 years ago, there was nothing like the things that I have, which is why I had to create it. Because listen, what we had back then 8 years ago was boring. No offense, you world and Kaplan and stuff. No, y'all work. But it just did not match well with my learning type. So I created what the market lacked. And that's the lane that I'm in. And I'm going to drive in it, boo. All right, so let's go ahead. What about a PCT? So what's a PCT? Patient Care Tech? I'm not sure. All right. So this for the first week or week one of NCLEX Trick or Treat extravaganza. It's a 3-week process. It's for the rest of October. Week one was nursing care plans / nursing process. Okay, you got to start somewhere. All right. So let's go ahead and I feel like enhance. Yes, here we go. Okay. I feel like somebody that's just getting started with like Facebook or something. And then we're going to go here. Wait for it. Okay, hold on. All right, let's go ahead and pull up. Boop. Can y'all see that? Let me see if I can see that. Let me move me out the way and put me down here. Okay, can y'all see that? Nursing process? All right, let me go back down what y'all saying. PCT. Yeah. I'm not sure. It depends on your life and everything like that. Hey, Rocky. All right, guys. So like I was saying, week one, we're starting, we were learning about the nursing care process and learning how to write care plans. All right. So each week I try to have like a commonly tested topic within NCLEX or nursing school. And then we attack it. Well, I attack it and I try to give you guys different ways to comprehend, and they're usually like fun and entertaining, because science says that when you're entertained, when you're learning, you retain it more. Right? So we're going to go through, I don't know about y'all, but care plans have me in a chokehold. Okay, that's just something that, honestly, it comes with practice. But admittedly, like as a nursing student, where this is literally the practice that you're getting, it's common for students to struggle going through, especially the first couple times, because monkey see, monkey do, but you don't got no monkeys doing around you. So I will be said, I'm not going to say that out loud on TikTok. We're going to go through it, okay, together. It's going to be a hands-on learning process or learning experience. And then afterwards, hopefully you guys registered and or signed up to be a part of NCLEX Trick or Treat, because everyone that did, which is free by the way, is going after this live. They're going to get a free nursing care plan. So it's going to be everything that we talk about is just going to be there on paper, so you guys can have access to that, so you can practice with that as well. Okay. All right. Hello. I'm glad y'all started doing it. I'm currently doing a care plan. That's funny. Okay, awesome. All right, so you guys know that before you can start doing any type of nursing care plan, you got to know what it is. Okay, so can anybody tell me what a nursing care plan is? Okay, what is a nursing care plan? And if you're in fundamental, if you're in your first semester, then this is definitely something that I think by now you should have definitely attacked. It's usually one of the first things you start or you learn within like the first week of nursing school. Let me see what y'all say. I'm glad you love it. So basically a plan of care for a patient. Absolutely. Let the word help you. Don't think about it too much. Okay. Just answer what it is. Another thing, really quick point. Depending on when you guys are taking your, and I'm gonna put up a poll. Depending when you guys are taking your NCLEX, whether it's before April 1st, 2023, or on or after it, that's gonna determine which NCLEX you take or which version of the NCLEX you take. So before, basically everything current all the way up to April 1st, 2023 is gonna be the current NCLEX. Okay. Everything after that is going to be the next generation NCLEX, or the NGN as they call it. Okay. Same content between the two, however, the way the questions are structured are way different. Okay. If you understand and comprehend the material, you're good either way, but just know that the content's the same, but the way the question is structured is different. Okay, so a lot of times when we're going through our NCLEX Jeopardy or something like that on live, I'm gonna ask you guys why. If you give me an answer, I'm gonna ask y'all why. Okay, and that's the way that you guys are going to start to learn how to, out loud at least, have nursing judgment, clinical judgment, okay? You need to know and understand the reasoning behind why you're doing something. Don't just do it just because you think that's the answer. And even if it is, the next generation NCLEX is not going to let y'all just get away with that. When I looked at the sample questions, a lot of it, like the first part is two parts really. The first part of like the questions, like the typical, like, oh, what would be the right step for you to do? And then the second part would be, give me the reason. Okay, so just kind of just know that. All right, so don't let that scare you. Just know why you're doing things. Know the rationale behind why certain interventions are the way they are. Just know why. Okay. All right. Let me see what y'all saying. I'm not good with filling the blanks at all. It's okay. The big thing is that you know what your weaknesses are, and then create a study plan around them. And the best thing to do when you're weak in an area is to just overload yourself with either questions in that topic area or question types. Okay. And we'll get into that as far as best ways to study specifically. All right. So yes, a nursing care plan, that is basically like a formal process where you guys actually create a plan of care for a patient. The thing about nursing care plans is that they are not one size fits all. Okay. Each care plan, even though there are specific, or there's certain parts of the care plan that may be used in other people's care plan, just like anything else, they're fit and individualized for the person as a whole. Okay. So even though two people may have the same nursing diagnosis, they may not be presenting with the same signs that led them to have that diagnosis. Does that make sense? And that's just kind of like with anything, let's take corona, for example. Some people had loss of taste. Some people did not. So it's just the symptoms and the clinical manifestations of anything will differ between people. You have your, you obviously you have like your basic like hallmark signs, but like the level, severity, everything that's going to change and be unique person to person. Okay, so just know that. Just know that. Let me see what y'all saying. Yay, I'm glad you love it. Right, it has multiple parts for each question. It does, and we're gonna get as you guys like subscribe to my TikTok, especially because I'm going to start to do them here. We're going to talk about actual next gen questions and actually go through strategies and like an actual question that y'all can see and work through. Okay. Do you think answering the objectives is a good study guide when you don't have a study guide? Absolutely. Those little comprehension checks within the book, yes. Anything is better than nothing, but let that be a good example of like the things that it's letting you know, like, hey, you should definitely make sure you have this comprehended. Make sure you're checking your comprehension in this specific topic or area. So just if you go by that, at least you're going to have some kind of basis. All right, so let's go ahead and get into actually like the first parts of like a nursing care plan. Okay, the thing about a nursing care plan is that, once again, it's derived based off your findings from you completing the nursing process. Okay, and it doesn't matter really what you do or what setting you work in. Doesn't matter if you're RN or LPN. Doesn't matter if it's hospital versus doctor's office. If you're a nurse in a clinical setting, you're going to be exercising the nursing process. You're going to be exercising clinical judgment / nursing judgment. Okay. That's why they teach it for everybody within nursing. Now, how we formally put that on paper, that's going to differ. Because let me tell you this right here and right now. The headache that is creating a nursing care plan that you learn within nursing school is totally different than how it is realistically to do it within the actual field or at work. It's totally different, night and day. Like, and the one that you do in nursing school and the ones that you do in nursing school, they go that hard and they want you to be real specific, and it's real tough because they want to make sure that you understand how to do it no matter what the setting is. Okay. I'm gonna answer in just a second. So yes, so the one in like your real world clinical settings, it's really going to be most likely like a couple questions on a program. It may be an Epic, or depending on what service they use or EMR that they use. But usually all that's computerized, and it's a couple clicks of the question, and it's kind of like automated, blah, blah, blah. But once again, just like with automatic BPs and like learning how to actually get a blood pressure manually, they just want to make sure that they drive in the fact that you know how to manually, from start to finish, create a nursing care plan and not rely on Siri or whatever else. Who's the other person? Alexa. There we go. So that is what we're going to be talking about and making sure that we understand, that we know how to do. Okay. Now, but somebody had a question. It said, is it true that the RN diagnoses and plans the care and the LPN implements it? Yes, but that's not saying that the RN's not implementing it as well. Okay. But as far as the NCLEX goes, okay, as for initial assessments, RNs have to do that. Creating the care plan, even though both RNs and LPNs create them depending on the setting, it's an RN that at least has to sign it off, if that makes sense. But for NCLEX purposes, RNs are the ones that the nursing plan, but LPNs are still tasked with the responsibility of knowing how to do it, just in case you maybe need to catch a mistake. Not saying that RNs make mistakes like that, but both of us, nurses, we make the mistakes, period. So, we have to know what we're looking for and why it's wrong or why it would be right. So that's why the NCLEX between RN and LPN is very, very similar, because we still have to know the same nursing judgment. How that's implemented and how we actually carry that out, that's going to differ when it comes to, like, you know, our settings and when we graduate, yada, yada, yada. But within nursing school, yeah, we've got to pretty much learn the same, you know, the why. We have to know the foundation of everything. Okay, so to answer that question, I hope that answered it. Yes, RNs make the plan of care, and then, you know, RNs and nurses, period, RN and LPNs implement it. That's why it's called nurse implementation, not RN implementation or LPN implementation. We're all working together. All right, so let's go ahead and talk about the types of nursing care plans. Okay, they can either be formal, like what you guys are really learning within nursing school, or it can be informal. And that's almost just not as formal. Okay. The informal ones, that's really just, it exists in your mind. It's like what you think, it's like the actual clinical judgment. It's you going through the steps and like the funnel basically in your mind. So that's an informal care plan. I see this problem. I think it's this. Here's how I'm going to correct it, and whether or not it worked and why. So that's just your clinical, that's just your roadmap in your mind, the informal one. The formal one is the actual care plan that we all hate within nursing school. All right. And like I said, those care plans are individualized. Well, the ones that you guys will be making, those are individualized to meet every patient's specific needs based off of their specific signs and symptoms. Okay. So remember, just know that. Let me go ahead and get into, let me pull up this other one. 1 second. Enhance. All right. So let's get into the actual nursing process. All right. So remember I said you can't write a nursing care plan without knowing the actual steps of the nursing process. And if you really look at it, basically a care plan is you writing down what you did during the nursing process. Okay. So everything, no matter what program you're in, you're going to need to know the steps of the nursing process. This right here: assessment, diagnosis, planning, implementation, and evaluation. Okay. So assessment is basically data collection. That's where you're actually assessing a situation, assessing a patient. That's typically when you're doing like that patient interview, like their health interview. Literally in the middle of trying to make my care plan. Just finished clinical yesterday. Ooh, you're in the right place then. Hello. All right. So yes, assessment is it like I said, that's your data collection. Okay. That's you being Scooby-Doo and looking for your clues. But in order to first, see if there's a problem, you have to read/learn the whole story. And that's when you have your interview, your health history, your patient family history, their chief complaint, like what's the purpose of you being here? How can I help you today? Depending on your setting, whatever. Like medical history, surgical history. So basically every time y'all go to a new doctor and they say come 30 minutes prior because you need to fill out some paperwork, whether that's digital or actual physical paperwork, this is what you're doing. They're giving you, you're giving them your own recollection of your patient data. Okay. Wait, someone said something. Is it true that all care plans have to have 2 diagnoses? What do you mean? I'm not sure what you mean. What you mean? 2 nursing diagnoses? I'm not sure what you mean. Got a test tomorrow on fundies with 50% is in the nursing process. Hope this helps me. Yep, I hope it helps you too. All right, so yes, assessment, your data collection, that's all the health information gathered into one place. It means nursing. Oh. It's based, somebody answered it, but the nursing diagnosis is based off the medical diagnosis. And we're going to get into nursing diagnosis versus medical diagnosis literally in the next, let's go ahead and talk about it now. The next step in the nursing process is diagnosis. Okay. That's when you identify the problem. You diagnose the problem. However, when you think about diagnosis, you need to know that there's a nursing diagnosis, which you will be learning how to make within your scope. And then there's a medical diagnosis, which you cannot do. Okay, you're not a medical doctor, you're not a medical physician with a medical license. Hence, you cannot give medical diagnoses. Does that make sense? So what you do, how you formulate your nursing diagnosis is based off of, really you build your own nursing diagnosis, especially if there is not a chance for you to base it off of a medical diagnosis. The interventions and the evaluation, all that stuff is going to be based off of what you would do for specific medical diagnoses. But a nursing diagnosis is, like I said, it's specific to the patient, but it covers, it doesn't cover a medical diagnosis because we're not medically diagnosing anybody. Does that make sense? Let me we'll really dive more into it. For example, let's say dehydration. Okay, dehydration is more of a medical diagnosis, right? A nursing diagnosis based off of dehydration would be fluid volume deficit. Does that make sense? Right. So it's like you're remixing what a medical diagnosis is what it is. Like you can't say, oh, somebody has heart failure. You can't say that. But what you can do is build your nursing nursing care, not care plan, but nursing diagnosis based off of specific things. And I'm going to put up a visual so you guys can kind of see it. Boom. Okay. So this is how you would write or formulate your nursing diagnosis. Okay. You would have a problem/diagnostic label resulting from related factors such as etiology, as evidenced by defining characteristics/risk factors. Okay. So you're building up your nursing diagnosis based off of what you assess or what you find in the assessment. So it's usually like signs and symptoms. We're going to also talk about like things that are a little bit more specific to the signs and symptoms. Like you kind of like step it down. You have like a more broad area, and then to individualize it, you like based off of these specific symptoms that this patient right here is showing me right here, right now. Does that make sense? So we're going to talk about some examples like real life examples where you can see kind of what I mean. Oh, wait, let me. Oh, here we go. Wait for it. Wait for it. Okay. All right. So yes. Let me go back up. Let's see what y'all saying. All right. So yes, your nursing diagnosis, right? The way we formulate that is it's a formula. This is your formula. Okay. Just like with any recipe or whatever has a specific formula so you can get to that end goal. This has a formula as well. Okay, so the first part that will usually be left blank, that's the part that you kind of plug and play. And it depends on, like I said, every specific person. You have a problem, which is also called the diagnostic label. Why are you here? Basically. And that's going to be resulting from a specific set of factors. And that's going to be as evidenced by an even more specific set of factors. Okay, this will be saved, and this will be uploaded to my YouTube channel for anyone that misses it and needs a replay. Okay, so yes. Let me give you an example. Ready? Okay. Let's give an example that everyone will kind of relate with. Okay. This diagnosis right here. Okay, let's break this apart. I made it as a funny, but it's actually, I made it based off of what it would be if it was like a real diagnosis. Okay, the thing about these nursing diagnoses is that definitely you can't just like make up your own. They have to, the parts of the formula have to be NANDA approved. Okay, they have to be NANDA approved diagnosis. Y'all have probably heard that name. Where's my book? Here. Y'all have probably heard that word, NANDA. Nanda. Not panda, but Nanda. Y'all probably heard that at least all through your first semester as they were like really trying to drive in nursing care plans. I was so sick of the word Nanda. But that is basically the guidelines that you're going to use and abide by, like their list of approved diagnoses that you can build your own care plan based off of. Okay? So remember I said that nursing diagnoses have 3 parts. Right? The problem / diagnostic label, related to. So whenever you see R/T, that means related to. Okay? The etiology / what did I say? Specific factors? Related factors. Sorry. The etiology / related factors as evidenced by, or AEB. Okay, sometimes they might see secondary to. It means because. Because of. As evidenced by, it's just another fancy word within the nursing or within the diagnostic world for just meaning because. Okay, so as evidenced by, and then you give signs and symptoms or clinical manifestations. So the specific data that you collected or that you observed or that you assessed during that first part of the nursing process. Okay, so let's go ahead and break this down. Okay, so chronic burnout, that would be our problem. Okay, that would be our main problem. Now, chronic burnout is not that is not NANDA approved. That was, like I said, this was me being funny. But if you want to have a list, you definitely need a list. But if you want to consult like the specific NANDA list, you can get like the NANDA book of diagnoses. I'm sure there's PDFs literally everywhere. I have a specific book that I even still use, even though I'm not practicing. I'm helping y'all practice. So back from when I was actually, creating nursing care plans, not initial because I'm not a RN, but I wanted to make sure that I had all, this is not sponsored by the way, I want to make sure that I had all the pieces of the puzzle, and this was a great book. It really helped me understand. I can't even tell you how much this was because I totally forgot, but it's I think it was like maybe $50, 35 or $50, something like that. And it just gives you, like I said, examples on examples and examples of like full care plans based off of those diagnoses. And it even has, I believe in the front, it even has like the actual diagnoses based off of like medical diagnoses. Okay, so when somebody asks, did you have to have 2 diagnoses? The reason why it's so different or important to know the difference between a nursing diagnosis and a medical diagnosis is, like I said, you have to make sure that you are choosing a care plan based off of the correct nursing diagnosis, which is based off of a medical diagnosis. So in this book, this is the name. It just says Nursing Care Plans, Diagnoses, Interventions, and Outcomes. This is from Elsevier. But like in this book, for example, I don't know if y'all can see that. It has like the table of contents. It's sorted by medical diagnoses, because a lot of people, when you think of diagnosis, you instantly go for medical, which is, that's just no fault of anyone's own. That's just society. You just think about like Grey's Anatomy and all these things. Like you're not hearing nursing diagnoses, be said out loud on like ER or whatever. That's not our part of the show. But based off of those medical diagnoses, for example, burns. Let's say burns. A burn is a medical diagnosis. Okay, so we would not be able to say burn, put burn, anywhere in our care plan, because once again, we do not have a medical license and we're not able to medically diagnose anybody. So what we would have to do, if we know that obviously it's a burn or something like that, we would have to take that medical diagnosis and form ours based off of what the patient either is experiencing or could experience. So it's either like a problem-solving care plan or a problem like addressing care plan, or it's addressing something that could be a problem in the future, like a risk. Okay, so let's go to burns, for example. I feel like I just saw it. Boom. Burns. When you think about burns, like I said, it's a medical diagnosis. Right. Thank you, Tashawn. I was like, can anybody name a nursing diagnosis that can be used in a patient with a burn? Okay, so let's break it down. Let's think about it. All right. When you have a burn, remember your whys. When your patient has a burn, they're at risk for infection. They're at risk for like hypovolemia. They lose a lot of their fluid through those burns. So anything regarding like dehydration or something like that, the nursing diagnosis version of that is like fluid volume deficit or hypovolemia. Burns hurt, right? Acute pain. Okay, it wouldn't be chronic pain because this burn isn't like a long time burn. You haven't had this burn since like childhood. That's not how it works. Usually burns are an acute situation that just happened. And so that's why they're seeking treatment. So it would be acute pain. It's not gonna hurt for long. Okay. Acute pain would be a nursing diagnosis. What would be another one? Can anybody tell me another one? Thank you. Acute Rose, acute pain, redness, blistering. Well, let's just talk about the first part, which is just the problem. Okay. Impaired skin integrity. Absolutely. It's a burn. All right. It's a burn. So there's some skin somewhere is burned off or burned in some capacity. All right. So before you have a risk for infection, in order for you to have like a risk for infection, which is a nursing diagnosis, but in order for you to have a risk for infection, you have to have a break in the barrier. Okay. And if you have a break in a barrier, you're going to always have impaired skin integrity. Does that make sense? So usually for the majority, I'm not going to say every time, but for the majority of the time, if you have impaired skin integrity, you'll usually see risk for infection. Okay? You usually see risk for infection as far as both of those or possible diagnosis based off of the medical diagnosis burns. Does that make sense? Impaired mobility, right? Disturbed body image, depending on the burn, how extensive the burn is. Disturbed body image, like I don't want nobody see me like this, burned up. People have impaired disturbed body image when they go get a chemical peel and they stay in the house for a week because of the peeling. Okay, that would be a disturbed body image. All right, does that make sense? Does everybody get that first part, which is the problem? Okay, you always have three parts: the problem, the etiology, and like the signs and symptoms. PES. Remember that when you're building a nursing diagnosis for a care plan. PES. All right. So for this specific one, the problem would be chronic burnout. Like I said, this is just for the funny. The chronic burnout. That would be our problem. And then our second part, which is our related factors or our etiology. Like, what is this stemming from? Why do you have this? Okay, that's how you can think about it. Like, if we were at the second step, which is the etiology / risk factors, okay, why? Ask yourself, why do I have this? And if you're going to ask yourself for this specific diagnosis, why would somebody have excessive nursing school stress related to chronic burnout, or vice versa? Why would somebody have chronic burnout? Excessive nursing school stress. Does that make sense? Okay, so it's like Well, give me a thumbs up if y'all get that part, so I can move on to the as evidenced by. All right. So remember, etiology is the origin. Okay. Why is this here? Thumbs up if you want me to go ahead and move to the right. Thank you. As evidenced by. Now this part's like I think probably your the easiest part to understand or pick out based on what it is. It's signs and symptoms. It's your clinical manifestation. These are your clues that you're originally going to see when you're doing your assessment. Okay. So for our chronically burnt out nursing student, why would you even think they're chronically burnt out? Okay. Why would you think that they must be going through excessive nursing school stress? What characteristics would you see on someone that is just completely burnt out? Okay. Dark, puffy under eye circles. No one's sleeping. Frequent mental breakdowns. Okay. Sleep deficiency. Increased caffeine intake. You know, like I said, this was just a little funny, but I wanted to give you guys like a relatable diagnosis or relatable situation and scenario where you can understand, okay, I definitely felt like this before. Based off of that, this is where each of those things will go in a nursing diagnosis. Okay. So now let's do a real one. Okay. Let's do a real one. And in order to do a real one, let's go ahead and I'm going to give you guys like a little scenario. We're going to role play. All right. So let's go ahead and go back to our nursing diagnosis. Okay. So y'all can know what parts to get. All right. So let's do let me role play real quick. Let me pull it up. Okay. All right. So y'all ready? Let's say we have who's in the news recently this week? Let's talk about, let's use, Krishan Rock and Blueface. Let's use them. Sure. All right. So, Krishan Rock, 23-year-old, female was admitted to, let me not use their real name because I don't want to speak nothing. All right. Instead of Krishan Rock, let's say Krishan Pebble. Instead of Blueface, let's say Purple Face. Okay. So Krishan Pebble is a 23-year-old, young woman who was admitted to Seattle Grace Hospital with the complaints of, someone said too late. Stop. With the complaints of intermittent fever, night sweats, and itchy skin. Okay. Y'all don't do that to me. Okay. She says that I noticed when I was with my boyfriend Purple Face, I noticed that there's also a growing mass on the left side of my neck. And I noticed that approximately 3 weeks ago. I have no appetite. Purple Face be trying to take me to like Steak Market and like Nobu, but I don't have no appetite. And I get easily irritated. Like I was on Baddie South and all those girls was just really, really annoying. And I found myself just being quick to anger. More than usual, though. So based off that assessment right there, now we're going to have to do a care plan based off of Krishan Pebble. Yeah, just Krishan Pebble. Okay? So let's go ahead and take our papers out. Okay? Let's take our paper out because Mine fell on the floor. Wait. Okay. Get my All right, so we have Krishan Pebble, right? Krishan Pebble. It's 23-year-old. Okay, we're writing down her history, y'all. We're doing it together. All right, we're writing down her history. she gone crazy. All right, she's a 23-year-old female that came into Seattle Grass, right? All right, so we have name, we have the age, we have the sex. What else did they give us? Yeah. All right, so now we're gonna go to, let's look at our nursing diagnosis. We're gonna go to our problem. Okay, well first, before we even do that, let's go to our assessment. Hold on. Let me pull up the actual assessment one. Where is it? Boop. Okay. We're going to go to our assessment. That's not the one I want. I want this one. All right, we're going to go to our assessment. And in our assessment, we have either subjective data or objective data. Okay? You need to put both. Okay, y'all know the difference between subjective and objective? Okay? Subjective data is like a patient's recollection. It's their recall. It's their words. It's patient. It's he say, she say, you know, but it's per the patient. It's something that cannot be measured. Doing like feelings or something like that. Okay? Data that cannot be measured is subjective data. It's subject to whatever their opinion is. Objective data. These are the cold hard facts. This is stuff that I can measure. These are measurable. This is measurable data. Okay. So like your vitals would be objective data. Them describing how things feel or how they feel would be subjective data. Okay. So based off of our Krishan Pebble and Purple Face scenario, our subjective data, aka, you know, her words, all right, it would be that what did she say? She said that she noticed, I'm adding this, but she noticed next to her purple face tattoo that there was like a lump in her neck. So she noticed a lump in the neck. Okay, did she say that it hurt? Did she say it was tender? She said it was tender. I'm adding this to tender. This is just what she's saying, okay? We haven't really touched anything yet. We're just talking. We're just doing our assessment, all right? In our health history interview, okay? She mentioned a lump in the neck. She mentioned that it was tender, all right? She also said that she hasn't been able to eat. She had a loss of appetite. Probably because he dumped her, but that's not for us to judge. We're just going to put loss of appetite. And then, what else did she say? She said she gets irritated really easier than normal. So increased irritability. Can you test someone? Can you measure someone's irritability? Can you measure like annoyingness level? Like you can't. So that's subjective data. All right. So you would just put what the patient said in quotations, especially with documentation. All right. So that's our subjective data. Now we did get some vital signs. All right. That would be our objective data. We noticed that even though she was complaining of an intermittent fever, when we did our vital signs, we got a BP of 120/76. Our temp was 100.6 degrees Fahrenheit. Our pulse was 90 beats per minute. What else am I missing? Respiratory rate was 18. O2, 100% on room air. Okay. All right. So that would be our data. That's our assessment, okay? That's all that goes in assessment, just the data that we collect, whether it's from us actually physically obtaining that data and measuring something, whether it's vital signs, especially if it's related to that specific problem. Anything that can be measured will go into the assessment, all right? I'm sorry, well, yes, assessment, but it would go under specifically objective data underneath assessment. Once again, subjective is anything that they pretty much say. Okay. The next part, once again, would be our diagnosis. Okay. Remember, to make your diagnosis, it has to be NANDA approved. All right. If you do not know what's Nanded approved, when you're making your nursing care plans, you need to pull up something, whether it's you pulling up a PDF, like Google NANDA. Let me Google it right now. NANDA approved. I can't spell. First, approved nursing diagnosis 2022. It's gonna pop right up because it popped right up for me. Why do you keep saying no? What are you doing? NANDA approved nursing diagnosis 2022. Boom, it came right up. So you have free resources, especially if you need like one in a rush. They usually have like your pocket versions of like nursing diagnosis, but in our day and age of everything being digital, girl, Google that thing. Google it, save it to your screen, whatever, however you want to do that. But you have access to the NANDA approved 2022 list of diagnoses. So just know that when you're making your diagnoses and your care plans, you need to have that in hand. Okay. Now let's go ahead and get into. Now there are 4 types of nursing diagnoses. Okay, good. I just want to make sure. If there are, not if, but there are 4 types of NANDA diagnoses right here. All right, we have problem focused, risk, health promotion, and syndrome. For the problem focused, it's a problem, whatever problem is presented during assessment, and that is once again based on signs and symptoms. Okay. That's the most common, and that's like the usual nursing diagnosis that you'll really be making majority of the time that you're doing like student nurse, or you're doing nursing care plans and making your nursing diagnoses, especially within nursing school. They really want it to be like problem focused, but like I said, if it's not problem focused, it'd be like a risk. Risk for infection, risk for something. Because once again, as nurses, our job is to prevent harm. The NCLEX is like the theme of the NCLEX is patient safety. Okay, so everything is going to be geared towards you knowing how to keep that patient, yourself too, but it's not nurse safety, it's patient safety. That's the theme, honey bun. They want to make sure that you know what to do and how to do things to keep your patient and patients around you as safe as possible. So keep that in mind when you're doing your studying. Focus on things that you know. If you don't know this, it can cause harm to my patient, which is definitely what they're going to be assessing for. Okay, so whether or not something has happened yet, as the nurse, once again, they just want you to just see into the future with your crystal ball, okay? But based off of signs and symptoms, and based off of your knowledge, your nursing knowledge, you can see if somebody's coming with a problem. You're supposed to be able to see what could possibly happen in the future if this is not get resolved. Okay, so if this acute problem, or it doesn't even have to just be acute, but if this present problem, the one that we focused on in problem risk right up there, boop, if that problem is not corrected, if your interventions and everything that you do for that care plan, your goals are unmet, then that's usually when they start looking at like the risk interventions to see what to do to, once again, further prevent this from happening. All All right, so risk prevention. All right, a problem doesn't exist, but there's a possibility based on the present risk factors. Jennifer, hey, I just found up live. Hey, welcome. Pull up a chair and a drink. All right, health promotion. This is their willingness to improve overall wellness. Me personally, in nursing school, the health promotion, those were like the easiest parts, because those care plans, first of all, they're boring to me. Like I said, I have to be stimulated to really enjoy what I'm doing. And those would be so boring to me, but it would still be the easiest. Those are going to be like, what's a wellness? Like, what's a health promotion nursing diagnosis? Hold on. Like lack of knowledge. That's a nursing diagnosis. That's really health promotion. What's another one? It's on the tip of my tongue. Literally on the tip of my tongue. Ooh, it's really going to bother me. Impaired health management is one. Y'all know what I'm saying? Okay, no one has an answer, so I think I'm on my own for that one. That's fine. But yeah, those are examples of Nanded approved health promotion. Knowledge deficit. Thank you. I was like, there's something with deficit in it. Yeah, lack of knowledge deficit, pretty much the same thing. But back in my day, it wasn't lack of knowledge. I think it was knowledge deficit. Or there was another way that we said it. But we're saying the same thing. But yes, that's the nursing diagnosis. That's a health promotion diagnosis. I'm sorry. That's Nanded approved. And then the fourth type is a syndrome. Okay, now these are a cluster of problems resulting from a common event. Okay, so this is, what's an example of, can anyone give me an example of a syndrome type of nursing diagnosis? For syndrome, I think it literally has syndrome in. They would usually have the word syndrome in the actual nursing diagnosis. Can anyone think of any Nanded approved risk nursing diagnosis? Andrew, you said Cushing's. No, give me like the name of a nursing diagnosis. That's a syndrome nursing diagnosis. It usually has the word syndrome in it. Not the actual problem, but the nursing diagnosis. Does anybody know? If you want me to just tell you, type in say tell me. No, dumping syndrome is a problem. That would be problem focused. Okay? We're looking for a syndrome nursing diagnosis. Dumping syndrome is a medical diagnosis. Okay? Cushing's is a medical diagnosis. Candy Dime said tell me, because I don't know. IMD said, okay, tell me. We have a lot of tell me's. So, post-traumatic syndrome, like rape survivor syndrome, chronic pain syndrome. That was good. That's good, Lala. Yes, chronic pain syndrome is a nursing diagnosis. That is very, very true. Chronic pain syndrome is a nursing diagnosis. Okay, remember, nursing diagnoses, are different from your medical diagnoses. Okay? All right, so did y'all hear me when I said those syndromes? Okay, so once again, we have I think it's called literally like rape trauma. Let me not say that word too loud, so they ban me for some craziness. But yes, that word. Hold on. And if you don't even know, do what I do. You're not going to know everything. Do what I do. And if someone asks you a specific question, or if I ask a specific question during any type of like tutoring or live or whatever, write it down, look it up right then and right there. So you can just know in that moment. Okay. So once again, let's try to find some other syndromes. There's one called disuse syndrome, post-trauma syndrome. That's what I mean. Post-trauma. But it is about that word, that R word, but post-trauma syndrome. And impaired environmental interpretation syndrome. What? So those are examples of syndromes. Like I said, it is a type of nursing diagnosis, but it's not. It's the most common of the first two: problem focus and risk. Okay. Risk for infection, risk for bleeding, risk for impaired skin integrity. That just has risk in front of it because you can see it. So if, like I said, if somebody has a gash on their arm right here, if somebody has a gash on their arm right here, what would be a nursing diagnosis? And by the way, it's not, even though I say it's not a one size fits all, it's also not a situation like nursing diagnosis. You don't just have one to be the answer, okay? It can be a slew of different things, right? It's not like A, B, C, D, this is the correct one. If I have this, then I have this. You have to know what applies to those situations. That's the thing about nursing diagnosis. You can have a combination of who, what, and whenever because it's specific to the situation, all right? So a big gash right here, all right? I'm bleeding. Not too bad, but I'm still bleeding. I'm bleeding. It's not stopping. I'm not saying I'm gushing out, but I'm not saying it's clotting either. So I'm bleeding. I have a big gash from here to here. I'm going to draw it. Boop, 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 boop. I'm just kidding. What would be nursing diagnoses? Impaired skin integrity. Absolutely. The skin is not so... The integrity of the skin is not so honorable, okay? It has been compromised. The skin integrity has definitely been compromised with this gash. So impaired skin integrity is definitely a nursing diagnosis, okay? Now that skin is impaired and this barrier is impaired, what's something else? Risk for infection. I see you looking ahead. Absolutely, okay. Risk infection. She just gave us a risk diagnosis. And impaired skin integrity is a problem-focused diagnosis. Somebody else said risk for infection. Acute pain. Remember, this hurts. I got a gash from here to here. Okay? Acute pain. Y'all gonna have to help me with this pain. Okay? Try not to leave out. Like that whole, like acute pain is one of those easy ones because really that can go into a multitude of different situations. If someone got slapped in their face, acute pain, does it hurt? You okay? Acute pain, that could be a thing right there. Boom, boom, boom. All right. So usually, especially for nursing school, when they want to see you like really go in on the and be detailed when it comes to these nursing diagnoses, throw in some acute pain diagnoses for a little razzle dazzle because, like I said, it can apply to almost every situation that is at least dealing with an injury. Okay, add it on. Just add it on. Same thing with risk for infection. If something in their skin is broken, if they have an impaired immune system, risk for infection. Okay, you have to know the situations. And this is for whether or not you are taking the current or the next gen NCLEX. You have to know why something is happening, what else could cause that to happen, and how to deal with it. How to correct it. Does that make sense? Would you say impaired tissue integrity is the same as impaired skin integrity? Yeah, Yeah. Because usually when I see, usually impaired skin integrity is, more for like obviously surface level, whatever, scrapes and cuts or whatever. But impaired tissue integrity, I usually see that with, and because I don't even know if that's still approved. I usually don't see impaired tissue integrity. I see like impaired tissue perfusion. That's what I see. Impaired tissue infusion. That's something. Let me look at. Have you seen impaired, or do you mean impaired tissue integrity? Has anyone used that? Yeah. I see impaired tissue perfusion is what I usually see. My fault. Impaired tissue perfusion is usually what I see. Okay. And usually when I see impaired tissue perfusion, it has to do with breathing, oxygen. Okay. Make sense? So somebody on a ventilator, like impaired tissue integrity, or risk 4, definitely. Risk 4, ineffective. Okay, you got to know these buzzwords when it comes to care plan. Ineffective, excessive, impaired, lack of, risk, chronic, acute. You got to know these like little buzzwords when it comes to disturbed, when it comes to your care plan. It makes it sound real care planning. Okay. Okay, so let's have a real quick. Let me go to effects. Let me go to, I just saw it. The next part of your care plan is usually like your goals and outcomes. Okay? Your goals and your outcomes. And you're doing that based on SMART goals. Y'all know what SMART girls? SMART girls. Y'all know what SMART goals mean? How do you measure a SMART goal? And SMART, by the way, is an acronym. Can anybody tell me what the S means in SMART? Or what it means, period. If you know what the whole SMART means, what does it mean? SMART goals. Very important. What are SMART goals? The S is for specific. What is the M for? What is the M in SMART for? Yeah, what is the M in SMART for? Measurable. A is attainable. Thank you, Safari. Thank you. What is the R? So far we have specific, measurable, attainable. What is the R? Reachable, realistic. I've learned realistic. Relevant, yes. And then T is, somebody did say what T was? T is time. Realistic or reachable, relevancy. Oh, I've never heard really relevant. Yeah, not relevant. And then T is time bound. Okay, so as specific, you want to make your goals as specific as possible. Okay, and when it comes to like nursing goals or nursing goals for nursing care plans, once again, it depends on that patient's symptoms and their overall like history. Okay, so let's do an example. Somebody give me a medical diagnosis. Give me a medical diagnosis real quick, and we're going to start one. But yes, specific is, once again, you want to set real specific goals, okay? Don't say like, oh, I want this to happen. Specifically, like say exactly how you want it. Like set real numbers with real deadlines, okay? M is for measurable. Make sure that you can track the goal so you can see whether or not it's working, not working, it was a good day, bad day. It wants to be something that's measurable. A, attainable. Is this even possible? Or are you like giving me a pipe dream? Like, is this is world peace, solve world hunger, or is this an actual attainable goal? Okay, me saying I want to make $1 million tomorrow is not an attainable goal for the majority of us, but but an attainable goal would be, I want to complete 2 things off my checklist. That's attainable. Realistic. I feel like that goes hand in hand with like attainable. Like, be honest with yourself and see if it's actually something that can be completed with your skill set, right? And then T is time bound. Give yourself a deadline. Okay. Listen, as somebody with ADHD, I had to like have smart goals like posted on my wall. Okay. Not just for nursing care plans, but just to apply it for the goals in my just everyday life. Okay. As a nurse and an entrepreneur. All right. All right. So you guys are giving me, you're definitely giving me some medical diagnoses. Okay. All right. So interventions are going to be, what are you doing? Hold on. Let me see if I can move this. Can I move my head? Okay, yeah. Boop. Wait. I'm going to move this. Put it over here. Okay, yeah. Interventions are what are you going to do? And the evaluation is, once again, did you meet your goal? Did you not meet your goal? Okay. That is the columns that you usually see within a nursing care plan based off of the steps of the nursing process. Okay. So let's go ahead and start from the very beginning. Let me see what y'all saying. Somebody said burns. We kind of did burns. Someone said asthma, myocardial infarction, diabetes. Let's do... burns is a good one. I love doing burns, but we kind of just did it. Let's do... I'm using this nursing care plan book. Once again, not sponsored. They don't pay me nothing to talk about this book, okay? They don't pay me nothing to talk about anything. However, as someone that was a nursing student, okay, and that really used these resources, I'm going to share that wealth with you guys, all right? I'm going to share it with you. If it's not something that I can provide y'all, I'm not going to gatekeep and prevent y'all from finding somebody else, somewhere else, okay? I'm not going to have a care plan book. I'm not. But we can talk about it together and really figure out how to do it. But recommendation, if you can, this is a great book called Nursing Care Plans, 10th edition. This is a Elsevier. It's them. This says Diagnoses, Interventions, and Outcomes. I'm a real simple person when it comes to, like, I need my information presented to me in as simple format as possible, because as a visual learner, I'm going to need to have to do something with it anyway in order for me to retain it and comprehend it. So I just give it to me as plain as possible. And this is what that book does. Like, don't try to, I don't want no fluff. I just need straight to the point. So then I can supplement that with my, my own unique studying style and what I do to help me really study. But this book was like a lifesaver. This is the 10th edition, so this is the most recent because I get new editions to make sure I'm keeping up with the actual real strategies and parts about whatever test, whether it's NCLEX, TEAS, HESI. I'm making sure I'm up to date as far as everything goes. But back when I used it in nursing school, it was just a different edition. I don't remember what edition, and I dang sure don't have the book. But it was basically this book. Okay, I just needed something that was like, it gave me an examples and steps without me having to really try to figure out what it is. So let's go ahead and let's do, somebody said asthma, so let's do asthma. No, I want to do diabetes. Okay, let's do diabetes, especially because week 2 of NCLEX Trick or Treat is going to be, we're talking about diabetes. Okay, we're talking about diabetes next week. Well, they're out this week, week 2, starting tomorrow. on through to next Sunday. So let's go ahead and let's dip into it. Let's go to diabetes, okay? Mind you, I wanted to make sure that, I asked y'all what, for an example, because I don't want y'all to think that, like, when I come in here to try to give you guys like an interactive step-by-step something, I'm just like giving you guys just the easiest way. No, I want us to do it together so you can see that there's different ways to get to a nursing care plan, especially based off of people's learning style. But I wanted us to build it together as opposed to just tell you, oh, look what I copy and pasted from Etsy. Like other people. But, I just wanted to just make sure we did it together so you really understand. So this is exactly verbatim, like what I would do if I was developing a care plan. All right. So we said diabetes, right? I'm going to go to the index, honey bun. I am going to go to the index. And I'm going to search for diabetes. Remember, diabetes is a medical diagnosis, right? Diabetes is a medical diagnosis. Please do not forget that a medical diagnosis is very different from a nursing diagnosis. Wait. Okay. And even though those two diagnoses pretty much collaborate to make sure that the patient gets, the best interventions and care from all different disciplines, it's still separate. Okay. And it's very important to know that. So let's go to diabetes. And let's do diabetes like mellitus. I know that's what you meant, but there is a diabetes insipidus. So I just want to just make sure we're clear. Diabetes mellitus. Let's go to diabetes mellitus. And I lost the page. This is recorded. Let's go back. Definitely lost this page. No, it's an 873 or something. Yep, right here. So we're going to diabetes mellitus. Yep. All right. Diabetes is an endocrine disorder. So depending on how your book kind of has everything sorted out, make sure you're looking in the endocrine / like metabolic care plan section if you have a book and you want to see it like that. Okay. So yes, let's talk about diabetes. That is the medical diagnosis. So in order for you to create, once again, your care plan, you have to know, you have to at least assess, to get your signs and symptoms and everything like that. But you should know that based off of, if you do have something that's just based off of the medical diagnosis, there are certain Nanded approved diagnoses that you would probably find to be applicable to that patient. Okay, you can't just pre-fill in like the actual nursing diagnosis, but you can like the actual care plan, but you can at least get the diagnosis or a possible differential diagnosis. All right, so based off of diabetes, when you think about diabetes mellitus, that's blood sugar. What do you know about patients with diabetes? They get infections really quick. Well, not really quick, but they can't fight off infections. They have a lowered immune system. They typically have issues with their blood sugar to cause them to go into DKA / coma, that stuff. That's what we know, right? Just without getting an actual scenario, that's what we know. So can anybody name just one, and I'll name the rest. Can anybody name a possible nursing diagnosis for a patient with medically diagnosed diabetes mellitus? Can anybody tell me one? And if not, just tell me. And I will literally read you what they have and why they have it. Want me to tell you? Glaucoma is a medical diagnosis. We're looking for a nursing diagnosis. Renal failure is a medical diagnosis. We're looking for nursing. Okay, so what's a nursing diagnosis based off of any of those that could apply to a patient with medically diagnosed diabetes? Can anybody say anything? If not, just tell me. Dry skin isn't a NANDA approved diagnosis. Risk for infection. Thank you, Bank Rollcast. Risk for infection. That is a NANDA approved diagnosis. Absolutely. All right. So somebody said, Kenny just said, tell me, girl, because, all right. Let me go back to it. So a NANDA, these are the NANDA approved diagnoses, possible diagnoses, okay, for somebody with medically diagnosed diabetes. All right. You have risk for hyperglycemia / risk for hypoglycemia. Okay. Risk for unstable blood glucose level. That's good. But I'm not sure if that is NANDA approved for 2022, but that is basically the risk for hyperglycemia, hypoglycemia. That's just another way of saying it. But I haven't seen it written like that. I would love it to be written that way. But I think they want you to be specific as far as those unstable blood glucose levels. Is it unstable because it's too high or too low? So I would be a little bit more specific and say, risk for what that unstable blood glucose level. Risk for hypoglycemia, which is too low, or risk for hyperglycemia, which is too high. Okay. All right. So that's one of them. Okay. Another one is risk for non-adherence. Okay. Usually, the regimen for insulin, taking your insulin, checking your blood sugar, all that, for diabetics at least, especially if they're type 1 and young, they're usually going to not adhere to that regimen. So there is always a risk for non-adherence. Okay, and that could also be because of in insulin being insanely expensive. It could be because of financial struggles, whether or not they know better, like health literacy. So there could be a lot of reasons why a patient's not adhering to the regimen, but that is a very real and common problem with people with diabetes. Okay. It'll be on YouTube. What's another one? Another one is risk. Somebody said it. Risk for impaired skin integrity. I'm gonna ask y'all a question. This is a clinical judgment, nursing clinical judgment exercise. All right. Risk for impaired skin integrity, specifically for patients with diabetes. Where on their body do they want you to pay special attention to for any type of impaired skin integrity? Who gonna tell me why? Okay, Patrice, tell me why. Everybody that said foot or feet, tell me why. Why is it important to evaluate feet on diabetic patients? Mander said wounds. What about wounds? Necrosis, poor circulation because of sweat. They can't feel them from the neuropathy because a little cut could go bad fast. Ulcers, nerve damage, poor blood perfusion, all that. Yeah, even though feet tells a lot about your health, they want you to specifically know why. They want you to know why. Okay, so as far as that skin integrity, that neuropathy, all right, that alteration in sensation, aka neuropathy, that's popular or not popular, but that's a common symptom of diabetic patients. All right, that decline or that alteration in sensation, a lot can happen on that foot, and because of the decrease in sensation, they won't know what's happening. Okay, so that nerve damage, that it prevents them from being able to really feel everything that's going on, so they don't think to look. You know, you walk on your feet every day. You don't think, oh, let me look in the bottom of my feet if it's not something that's hurting, right? So because of that neuropathy, they could have a cut, a ulcer, something on their foot that they won't know to look at or to evaluate, to treat, and that can go bad real fast, as somebody said. But that can go bad real fast, aka causing necrosis and cause an infection that can ultimately cost them their limb. Okay? My study guides are for the NCLEX period, LPN and RN. Okay? Is it possible to get a replay? Yeah, I'll be everything after this week. I'll be bundling together everything. I mean, not this week, but after this, each week I'll be bundling together. I guess each previous week, so you guys can get the replay and the like the quiz and the materials from the rest of the week that you may have missed, so you can go ahead and review it then. So it's either going to happen at the end of this month or this week, depending on most likely this week, actually. But yeah. What else was I saying? So yeah, neuropathy, obviously. So it would be like neuropathy and an infection, because the infection, they have a because of the poor circulation, they have a greater chance of really not fighting, infection period. They don't fight off infections as well. So if they had some kind of cut or whatever due to that neuropathy, both of those would kind of play a role in them losing their limb. So just make sure you know both of those, how both of those could go from good to bad real quick, as my dog said. So just make sure that skin remains intact on feet. That's a diagnosis as intervention. Another one would be hypovolemia. All right, hypovolemia, which is low fluid volume. Hypovolemia or fluid volume deficit. That's pretty much the same thing, but this just says hypovolemia. All right, so that's usually because of active fluid loss. Remember, that fluid can be urine, blood, sweat, whatever that could be. Fluid loss is fluid loss. So if you have somebody that's urinating a lot, as in one of the signs of diabetes, they can be at risk for hypovolemia or just hypovolemic period. Speaking of symptoms of diabetes, can anybody tell me the three P's of diabetes? Tell me the 3 P's of diabetes. We'll definitely get into it later this week, but tell me the 3 P's of diabetes. Polydipsia, which is polyuria, which is, what's the third one? Polyphagia, absolutely. Polydipsia, urea, and phagia. Okay, urea is increased urination. Polydipsia is increased what? What is polydipsia? Polydipsia, thirst. Okay, you know how I remember what polydipsia is? Dip rhymes with sip, so I think about polysipsia. Thirst. That's how I remember polydipsia. And then polyphagia is increased what? Did somebody say that already? I don't remember. What's polyphagia? Increased what? Polyphagia is increased what? Hunger. All right. Peeing a lot, eating a lot, Drinking a lot. I forgot myself. Peeing a lot, eating a lot, and drinking a lot. Okay, so if they're going to be urinating a lot, aka the polyuria, the hypovolemia can be one, and a risk for hypovolemia can also be a nursing diagnosis. Okay, if they are urinating a lot or sweating a lot, they can also be at risk for dehydration. Okay, which is, once again, where you would come in the nursing diagnosis for dehydration, you would come in and say like fluid volume deficit. Is dehydration, I don't think it's a nursing diagnosis. Is dehydration medical or nursing? Is it a medical or nursing diagnosis? Dehydration. Oh shit, I think my thing's about to cut off. It might cut off too. It might. I'm not sure. What is it? Medical, right? Dehydration is a medical. So what would be, we just talked about, but what would be a nursing diagnosis for the medical diagnosis of dehydration? What's the nursing version of that? Right. What is the nursing version of that? And as you look at more care plans and do them more, it'll start to come to you real easy. Fluid volume deficit, absolutely. And once you kind of know that once you're able to know that one time those links exist, then everything else it'll just come to you so fast, okay? If someone is dehydrated, losing a lot of blood, hemorrhaging, all that's hypovolemia. Okay, so the interventions that you would do and that stuff that you would do would be attached to that specific diagnosis, whether it's fluid volume, it will be attached to fluid volume deficit, whether it's dehydration, bleeding out a lot, whatever. The nursing diagnosis, okay, that's what's gonna be the same. Deficiency of fluid volume. There's a bunch of ways to like mix and match it, but they all say pretty much the same thing. You just gotta at least know which one's Nanded approved. Okay. Impaired nutritional intake is another one for diabetes. Disturbed body image. Those are the ones for diabetes. Okay. So whenever you have to complete a care plan, go based off of, like you said, if they allow you to just pick a medical diagnosis, take a book like that and just search the medical diagnosis to pick one of the nursing diagnoses that fall within that medical diagnosis. That's the easiest way I can say to complete a care plan. If it's a scenario that you're going to have, then once again, you would just need to know based off of everything that you find, everything that that you assess with that they give you in that scenario, still use that to make your nursing diagnosis. Okay. Yeah, we talked about hypoglycemia. Sure did. All right. So that was the diagnosis. Let me see what else I have for y'all. 1 second. Because we're about to do an actual, like, for real deal care plan. Not me just talking shit. All right, so we're going to do this. We're going to build a care plan with this scenario start to finish. Does anybody have any questions real quick? Before we dive into, now that you guys kind of know everything about, you know, the nursing process, the types of nursing diagnosis, the difference between medical and nursing diagnosis. Now we're going to apply that. If anybody has any questions, please drop them now. If you want me to clarify anything, but if not, if y'all are ready to go ahead to the scenario so we can build it together, give me a thumbs up. Thumbs up if you are ready to do the scenario. Thumbs up if you are ready to do the scenario. All right. Okay, 1 second. Got my thumbs? Okay, awesome. All right, so let's go ahead and get this started. All right. If you can have something that you can write on, so you can take note on, because I'm going to be reading the scenario, almost like we're doing like a report. I'm going to give you all the scenario. I'm just going to, call out things. And I'm actually going to use my Nurse Bucks clinical sheet. Okay, the scenario that we're going to use is going to be like an actual real not a real scenario like that, like not with real patient identifiers, but the but when I say like a realistic scenario, I mean like this is a realistic as far as how you would do intake or do an assessment, not even assessment, how you would do intake on a patient that's maybe being transferred to your unit or something like that. This is also, the first part's going to be an example of how you would actually take report. Okay. Now, when you are in nursing school clinicals, more than likely, they're just going to tell you to pick a patient's chart and like kind of pick a diagnosis and go based off of that. So for me, I had to actually go through patients' charts and pick like a visit, like a date of a visit that had like a note and everything else, blah, 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 and go through that note and make my nursing diagnosis based off of that medical chart. Oh, thank you. Thank you. Right, yeah. If there's anything you want me to add, please let me know. Okay. Let me see what y'all saying. Okay. So yes. So we're gonna go through our report. I'm gonna read it through, and then we're gonna go through it together. I'm gonna say what parts, like, not that of important, all of it's important, but where I would put each thing, especially on this paper. Okay. Wait, go. All right, good. Okay. Where is our case study? So another thing, depending on, as I pull this up, depending on when you take your NCLEX, whether you are a current NCLEX or you will be a current NCLEX taker, or you're going to be taking it on or after April 1st, 2023. So you'll be taking the next gen one. Get familiar, get used to this type of these types of scenarios as far as the student goes. 8 hours. Oh Lord Jesus. And what I mean by that is you're gonna see a lot of reference to like scenarios, clinical scenarios and case studies. Okay, you're gonna like a question. You're gonna have one case study on the next gen, and it's gonna apply to like the next 8 questions. Okay, so we're gonna take this specific chart. All right, I'm gonna read it through, and then I'm gonna tell you guys, we're gonna build a care plan with this one. All right. This is I won't even say what it is specifically. All right, so this is our chart. Okay, we have a patient name is KH, like the letter K, the letter H, that's what we're going to put as our patient identifier. Because even when you're doing your care plans, obviously you're not going to really write like real patient identifiers. HIPAA, HIPAA, HIPAA. Hungry, happy, HIPAAs, okay? Abbreviate, please. Or just use a different name in general. All right, so this person, we'll just say KH. All right, KH is a 62-year-old female patient. I wonder if I can show y'all this. I really wonder if I can show y'all this. One second. Let me see if I can. And then I'll do single page. Let me see if I can show y'all this. Wait. All right, wait. Effects. No effects. Can I turn? No, wait. Wait. Nope. Wait. Hold on. Flip camera. There we go, Jesus. All right. There we go. All right. Can y'all see that? Oh my gosh. Can y'all see that? Ah. All right. Thumbs up if y'all can see that. Okay, hold on. Patient duck. That's funny. By animal names. Ooh. That's cute. All right, so we're gonna call him Duck. All right, use something like that. All right, so KH is a 62-year-old female patient who presents to the emergency department with an acute onset of confusion, shortness of breath, fatigue, and a hacking cough. Initial physical exam reveals patient alert and oriented ×2 with disorientation to time and place. Basilarity crackles noted in anterior and posterior lung bases, S1 and S2 heart sounds, and no murmur present. No JVD, slight clubbing in cyanotic nail beds, and non-pitting edema in lower extremities. Now, our vital signs. We have a heart rate of 110, a BP of 97/70, respiratory rate of 28, pulse ox 93 on room air. She reports difficulty completing her daily tasks, such as watering the garden and taking her dog for a walk. Oh, due to, that whenever you see D/T, it's due to increased shortness of breath, dizziness, and extreme fatigue. Past medical history reveals a significant history of smoking, obesity, and obstructive sleep apnea. In addition, the patient reports not using her at-home CPAP machine because it is too uncomfortable. Duck received 4 liters supplementary oxygen via nasal cannula, and her pulse ox now reads 98%. A cardiac angiography CT revealed a 15 to 20% ejection fraction. EKG showed normal sinus rhythm with no ST changes. Okay? This is our scenario. This is our case study scenario, however you want to call it. Okay? Everybody got that? Now let's go through. I wonder if let's see if I can do this. Wait for it. Hold on. Wait, can I do that? Boom. Nope. Okay, whatever. Hold on 1 second. Cool. All right, so let's go ahead and let's write down all this important information. Okay, well, this is what you have to refer to. So based off of this, okay, we're going to create our care plan. All right, now remember, they already did the assessment for us. We see our assessment results. They already recorded the vital signs, all that good stuff. So we would just take our care plan template, which everyone that registered will be getting that in an email, like a blank template that you can use to help you. We're going to be writing that and plugging and playing all that information into our template. That's going to help us write our care plan. All right. So remember the process of the nursing process: add PI, assessment, diagnose, plan, implement, and evaluate. First things first is assessment. Remember, you have 2 types of data for you to record. All right, it's going to be objective and subjective. Actually, let me go ahead and no, stop. Let me go back to our breakdown of it. Okay, wait for it. Okay. All right, sorry. Woo. All right, I'm going to talk about the details here. All right, so in the template that I'm going to be emailing you guys about the care plan, PE, left side of heart failure, you're doing a lot of medically diagnosing, which you are not. If you're a nursing student or in this live, you are not licensed to do so. Okay. Y'all see me? Y'all hear me? Just want to make sure. I'll be back. Okay, thumbs up if y'all can still see me. Okay, perfect. We back in action? We back in action? Okay, perfect. All right, so let me bring that back because I definitely lost that call. Okay. Here we go. All right. Let's go ahead. Before we even do that, we're starting an assessment. Remember, we're doing it from beginning to end because y'all need to know how to, once again, write the care plan, not just make a diagnosis. So we're going to do all of that. All right. So let's start with assessment. Right here, subjective data and objective data. The things in this this page right here that you guys see, all right, these are the columns within a nursing care plan. Like I said, I'm gonna give y'all a template. Y'all have the template, but this is basically what y'all will see. Okay, so this is what's gonna help you guys once again build your care plan. So you have objective data and subjective. Remember the difference between the two. Which one is measured, subjective or objective? Which one is measurable, subjective data or objective data? Which one is measurable? My instructions said Nanded is outdated. Listen, a lot of things are like outdated as far as what the NCLEX want to happen and versus what actually happens in NCLEX. I mean, in the real nursing world. It's a bunch, but for nursing school and NCLEX purposes, just do what these people just want you to do. Just know you're not going to be doing this like that in the real world. Just, you have to do it to get through nursing school. So just when in Rome, win in Rome. All right. So yes, the answer is objective. All right. Objective is going to be your measurable data. Somebody said subjective is what the patient tells you. Right. Okay, so objective data. The stuff that we have that would be objective data, stuff that can be measured, your vital signs. Okay, we had a heart rate of 110, and we're going to write this stuff down because remember, we're going to take this and we're going to use it when we're building our actual full nursing diagnosis. All right, so what do we have? Our manifestations, everything that we recorded. We have a heart rate of 110. We have a blood pressure of 97/70. We have a respiratory rate of 28 breaths per minute. We have a pulse ox of 93% on room air. So usually how you would document that is 93% O2 on RA. RA stands for room air. Okay? So on room room air. The next line is, she reports difficulty completing her daily tasks, such as watering the garden and taking her dog out for a walk due to increased shortness of breath, dizziness, and extreme fatigue. Is that objective data or subjective data? She reports completing her daily tasks such as watering the garden and taking her dog for a walk due to increased shortness of breath, dizziness, and extreme fatigue. That would go in subjective, okay? So difficulty completing daily tasks, ADLs, activities of daily life, activities of daily living. So difficulty with ADLs. And they even gave examples such as watering the garden and taking her dog out due to the increased shortness of breath. You can put SOB. It don't stand for son of a shortness of breath in the medical world and the nursing world as well. And the increased shortness of breath, dizziness, and extreme fatigue. All that is subjective data. That is per the patient. We can't measure fatigue. You feel me? We can't measure how dizzy somebody is. I can't say she's more dizzy than you. I can't say that. No one can say that. Okay? It is definitely subjective per the patient. As far as more of our subjective data, that the assessment data, we have patient alert and oriented times 2. So in order for us to record that, how would you document patient alert and oriented times 2 with disorientation to time and place? That would be, how would you write that? Just documentation wise, documentation talk, charting talk. How would you document patient, alert, and oriented times 2? Thank you, UA Crimson. Yes. Yeah, AAO or AA2. This is alert and oriented. So I'm put AAO times 2, and then specify just like Crimson said, disorientation, or just put AAO times 2, time and place. Wait, pause. I lost it. Wait. No. Disorientation to time and place. They're not just alert and oriented to time and place. They're disoriented to time and place. Okay? So yes, I would literally put disoriented to time and place. Just like Crimson said. Okay? AAO times 2 with disorientation to time and place. Absolutely. What's the next line? We have basilarity cracks noted in anterior and posterior lung bases. So that would be an assessment of the lungs, right? That would be a respiratory assessment, correct? It'll still fall in assessment, but basilarity cracks noted in the anterior and posterior lung bases. Is that objective or subjective? Basilarity crackles. All right. It is, what is it? Objective or subjective? Objective, right. So we have basilarity crackles. In the anterior and posterior AMP lung bases. Okay, it says S1 and S2 heart sounds, no murmur present, no JVD, those are normal things. Slight clubbing. Okay, you're gonna write the abnormal things. So it's important to know what's normal versus abnormal, especially for the next gen. Okay, basal crackles noted in the lung bases, that's abnormal. That's an adventitious lung sound. So we record that. S1 and S2 heart sounds noted. That's normal. No murmur present. Awesome. No JVD. And when I say you don't have to write it down, I mean to build this specific care plan. You still need to chart that, which is what we're reading, but we're talking about writing the care plan. All right. Slight clubbing and cyanotic nail beds. So we would put that. Slight clubbing, cyanotic nail beds, and non-pitting edema in lower extremities. And put bilateral non-pitting edema. Bilateral lower extremities. Okay. All right, so that is our assessment. The next thing we do after we write down what our assessment is and how, trying to figure out what everything means. Okay, this is the part where we're gathering our ingredients, okay, for our recipe of the care plan. All right, now we're gonna go to the diagnosis. Okay, this is gonna be the part that we're gonna use the Nanded diagnosis to go based off of. Okay, so based off all this that can be that we have written down, remember, we are not a medical doctor. It's not our job to try to figure out, is this a PE? Is it congestive heart failure? That's not what the question's asking you. That's not the question we'll ever ask you. It's outside your scope. Okay, we're making a nursing diagnosis. All right, so we are going to be, wait, what's that? Okay, we're going to, once again, we're going to bring that up. All right, so remember, when you're writing your nursing diagnosis, think about PES, problem, etiology, and signs and symptoms. Oh, wait, my bad. Oop. Signs and symptoms / risk factors, all that good stuff. That's what defining characteristics basically means. All right, so think about PES and use Nanded when you're doing it. Okay, so let me bring that down. Bring that down. Okay, so once again, this is the formula for how to write a nursing diagnosis. So we have our problem. All right, and our problem is going to be the one that's going to be based off of everything that we have written down. What would you say a problem is? Okay, you can, even if you don't know what the nursing version is, for all those that were telling me like medical diagnosis, if that's what you're thinking, don't put down the medical diagnosis. You can use that to search for nursing diagnosis. Like people were saying, is it a possible PE? That's not for you to say, but you can look under pulmonary embolism to see what possible care plans could arise from somebody with that. All right. So somebody said impaired gas exchange. All right, so let's go with impaired gas exchange. That is a Nanded approved diagnosis, so we're going to go with that. Impaired gas exchange. My pen died. Impaired gas exchange. Okay, that's our problem. Now, impaired gas exchange related to, resulting from, whatever. Remember, we're looking for what caused that. What is the etiology? All right, where's that stemming from? So the impaired gas exchange, where is that possibly stemming from as far as our etiology goes? And even our related factors. What could be a common or a possible etiology? You said impaired gas exchange. Now that you said impaired gas, let me go ahead and this is what I would do. Remember, I'm going to go to, since we've already decided on impaired gas exchange, let's go to my book. Well, I'm going to go to my book. Y'all do whatever book y'all have. I'm going to go to impaired. Really, it'll be gas exchange. And I'm going to go to, hello. 58. Let's go ahead and go to page 58. Let me see what y'all saying. Acute asthma. Someone said acute asthma. Why do you think they have asthma? There was nothing that said that patient has asthma. We're not putting our thoughts. We're not putting what we think it is. We're making this off of information that we definitely have. Okay. Of that scenario, there was nothing that said that patient had asthma. Okay. And even none of the symptoms even said it, because even if she maybe has undiagnosed asthma, based on our assessment, there wasn't things that definitely scream asthma. Okay, especially when they did the assessment on the lungs. They said they had basilar crackles in the anterior and posterior lung bases. That's not indicative of asthma. When you think about asthma, you're going to think about wheezing. Okay? Crackles is indicative of what? When you hear crackles in a lung, what is that indicative of? Crackles in a lung lets you know what? It's indicative of what situation? Crackles equals fluid. Thank you. So we have basilar crackles, which is the base, all right, in the anterior and posterior lung bases. So that's where the fluid is in the lungs. So now, once again, that's the data that we have. What can be indicative of, that? Once again, not our situation, not our place to try to figure that out. It's our place to assess, record that information, and relay it in our nursing care plan, so we can figure out what we can do within our nursing scope of practice and our nursing license to try to manage these factors. Let's say that. Okay, we can't medically treat anybody, but we can, do our nursing actions and interventions to provide, care to make them as comfortable as possible and to even avoid real situations and issues. Okay. All right, so let me go back to my impaired thing. Impaired gas exchange. Here we go. All right, impaired gas exchange. I'm going to read you what it says definition-wise. It says a change in the ability to adequately exchange oxygen and carbon dioxide in the lungs, which may alter the body's acid base balance. Okay, so whenever you have impaired gas exchange, when you see that, you usually you get that when someone is obviously exhibiting respiratory issues, breathing issues. Okay, whether it's shortness of breath, breathing too fast, it's off balance. It's an impaired gas exchange. That's what breathing is, a gas exchange. So if it's something happening that where we can't really get a good breath in, it's impairing our gas exchange. So that is a great example of a problem part of the diagnosis. So right now we have impaired gas exchange. Now we're looking for our etiology resulting from. It says common etiologies can be altered oxygen supply, ventilation, perfusion, and balance, and alveolar capillary membrane changes. Okay, so based off of our assessment, we had an O2 of 93% on room air. We had a respiratory rate of 28, complaints of increased shortness of breath, dizziness, and extreme fatigue. That's letting us know that there's some kind of issues going on with her breathing. So our etiology would be altered oxygen supply. Okay, so, and we also have basilarity crackles in the lungs and base, but we're not to that part yet. We're looking for, once again, common etiologies. So do y'all agree that a common etiology, the one that we would choose for this one, would be altered oxygen supply? I'm going based off of the book. I'm not making it I'm not trying to reinvent the wheel. Okay, I'm following the rules of how to create a care plan. Okay, all right, great. So we have the P and the E for our diagnosis. Impaired gas exchange related to altered oxygen supply. Now we're going to record our as evidenced by. And this part to me is the easiest part because it's literally the signs and symptoms. This is your specific data, your supporting data. Okay. It would be things that help support that the oxygen supply is altered. So what did we gather from our assessment that supports this? All right. So remember what they said. Can you spit back some of the stuff? UA Crimson said as evidenced by cyanosis in the nail beds. Okay. Cyanosis in the nail beds. Cyanosis means blue. Whenever we have a blue pigment to our nail beds, mucous membranes, skin, it means we have a lack of oxygen supply. Okay. Also, the clubbing of the fingers. Okay. The clubbing of the fingers is also indicative of not having enough oxygen. Right. So the clubbing of fingers and the cyanotic nail beds. I almost said air beds. That's a supporting data. Nail beds. Boom. That's one. Give me another one. So I learn more from you than I do in class. Oh, thank you. That means a lot. Give me another as evidenced by. Patient statements that she's unable to perform certain ADLs due to shortness of breath. Absolutely. I would just put patient reports of increased shortness of breath. Okay, give me another one. Right. The actual, all of its data, but you can put the vital signs that were, that's important to this. So all the vital signs that have to do with like oxygen level, breathing. So obviously we'll put the O2 being 93% on room air. Respiratory rate of 28, which is super high. Okay. Normals is like 16 to 20, really 16 to 18. 20 is like if you want to be cute, but 16 to 18 is usually about normal. So 28 is that's up there. Okay. What else? Extreme fatigue, dizziness. What else? The crackles in the base, basilarity crackles. AMP lung bases. Okay. Anything else? Anything else that I'm missing? I said extreme fatigue. Yep. I said that. Anything else? I think that's pretty much it, right? Also, at the beginning, y'all can't see it, so it probably escaped you. But if you were able to actually see the chart in front of you, I'm sure y'all would have remembered this. But remember that this patient presented with, where'd it go? Hold on. Wait for it. Hold on. Wait. Nope, that's not it. Where'd it go? What the hell? Hold on. Wait for it. Okay, here we go. It said that the patient presented in the ER with an acute onset of confusion, shortness of breath, fatigue, and a hacking cough. Okay, so we have cough. I don't think we said that. We have a cough, and we also have that acute onset of confusion, right? So acute onset confusion and hacking cough. Okay. So now we have our problem, etiology, such related factors, and defining characteristics / risk factors. So now we can put all that together, and now we have our nursing diagnosis. Okay, so based on this patient right here and the assessment that was given based off this patient, this is our nursing diagnosis. All right, impaired gas exchange related to or resulting from whatever. Impaired gas exchange related to altered oxygen supply as evidenced by extreme fatigue, dizziness, shortness of breath, clubbing of the fingers and cyanotic nail beds, an oxygen level of 90% or room air, respiratory rate of 28, basilarity crackles in the lung base, like those. Okay, you can put all of them. I would put all of them if it was me, especially because within nursing school they just want to make sure you can identify everything that's pertaining to this specific thing. So I would put all that within that column as far as my diagnosis. So go back to here, go back to there. So now I have my Nanded approved diagnosis based off of my assessment for this patient. Now we're going to go to goals / outcomes. And once again, they're going to be specific to this patient. Remember, she made such a big deal about not being able to garden her gardens and walk her dog. So that can be a goal, patient. But remember, she can't do it as often or as well because of her shortness of breath. So our goal would be to resolve that shortness of breath so she can actually, feel like she's breathing, so she can resume her activities of daily life that she's so excited about, garden club and, taking Bruiser out for a walk. Okay. So we're going to work, our goals are going to be surrounding resolving those factors that increase shortness of breath, dizziness, and fatigue. Okay. What else? Okay, so based off of, once again, our book, a common expected outcome would be patient maintains optimal gas exchange as evidenced by ABGs or arterial blood gases within the patient's usual range, alert responsive mentation, or no further reduction in level of consciousness. Remember, she's ANO times 2. She could at least be ANO times 3, if not 4. Relaxed breathing and a baseline heart rate for the patient. Okay, remember, we want our goals to be measurable, and she can't get back to her activities of daily living without resolving those specific things. So we got to resolve that and do what we can do to make sure that she's in a position to where she can resume her ADLs. Okay. Right. Annotated. This is the Nursing Care Plans, Diagnoses, Interventions, and Outcomes book. Okay. So boom. Now we have goals and outcomes. Now we have 3 out of 5 done. Next thing is our interventions. Okay. Our interventions are almost like, for me, like one of the easiest parts, because the interventions, and at least the why for the interventions, they don't change. Like, it's going to be the same intervention to correct the same problem, like almost each and every time. Like, if you have somebody that is, short of breath, an intervention all the time would be to make sure that they are sitting upright and not like laying down. Another intervention, once again, would be, if we're checking ABGs, would be to check ABG results. What's another one? Assess patient nutritional stat. Well, not that one. Because this one is, once again, specific to the patient. Assess for dizziness, lethargy, and educate patient on what would I educate her on? Like risk for falling, I would say, because the dizziness is a risk for falling. That's another one. So educate the patient on like fall risk, fall prevention. That's what I'm trying to say. Right. Elevate head of bed. Encourage use of incentive spirometer. Assess, since one of our assessments were cyanotic nail bed, an intervention another action or intervention would be to further assess the nail bed to see if it's still blue or if it's actually going back to a normal color related to that patient's race. What else? Monitor chest x-ray reports, because remember we have those lungs. We have the fluid in the lungs, so we got to see if that's being resolved. Nobody can see inside, can't be like, hey, how's your fluid in your lungs doing? Today it's fine. It's about, it was about a 4 yesterday, but now it's like a 3. No one can do that. So the best way to assess that would be radiography. So a chest x-ray, that you would monitor those reports, monitor changes in, breath sounds. What else would we do? Give me something else. Listen again to lung sounds. Absolutely. All of these are different interventions that you can do based off of, this patient's assessment. But the interventions based on that specific assessment, those won't change. That's what I mean. Like, it's always going to be, elevate head of bed if you want to do an intervention to help somebody, be able to breathe better. You're always going to listen to lung sounds. You're always going to monitor mucous membranes, nail membranes for any cyanosis. Those are the things that you're always going to do. Okay. Encourage slow, deep breathing because, thank you for saying that, UA Crimson. You said encourage slow, deep breathing, and you said something else. Encourage use of incentive spirometer. Why? What is the why behind that? Why do you want to encourage use of incentive spirometer? Why do you want to encourage slow, deep breathing? Why? The slow, deep breathing, that's going to increase oxygen perfusion, but that incentive spirometer, that's going to do a specific, thank you, hey Taylor, prevent atelectasis, which is what? Layman's terms, please, prevent atelectasis. What is atelectasis in layman's terms? If you were telling somebody with no medical anything what atelectasis was, what would you say? Collapsed lung, absolutely. You want to assess for signs and symptoms of possible atelectasis, okay, or lung collapse. And symptoms for that would include diminished chest excursion, limited diaphragm excursion, bronchial or tubular breath sounds, crackles, and a big one is the a tracheal shift. Okay, that tracheal shift would like almost veer to the affected side. Whatever lung is collapsed, the trachea is kind of gonna shift towards that side, and that's to kind of like compensate for the imbalance in the pressure. When one side's collapsed, the other side's not. So in addition to like they definitely won't be able to breathe. It's gonna be increasingly difficult to breathe. You want to assess for that because that's a complication of not being able to breathe properly. Okay. All right, makes sense? That's a big one. That's usually always like, they definitely test you on that, whether you know that atelectasis or a collapsed lung is a possible complication. So make sure you're assessing for that. All right. And then what else? That was intervention. And then evaluation. Is your goal met or unmet? Those goals that we made, boop, up there, our smart goals. What are some that we were talking about? No further reduction in, level of consciousness. Are they still alert and oriented ×2, or are they now A&O ×3 or 4? If so, you're meeting your goal. Okay, so you gotta record the data of, or not the data, but you're recording the result of your interventions. Okay, and you're comparing it with your baseline for this patient. Remember, those nail beds were blue previously. After our interventions to try to help with breathing, are those nail beds still blue, or are they now appropriate for skin color? That answer is going to be let you know whether or not they met their goal, they didn't meet their goal. Does that make sense? It says, can reducing anxiety be an intervention as well? For this patient, she didn't really give you signs of anxiety, nor did she mention anxiety. It didn't say that in her in this case profile that she was any type of like anxious. However, I will say that once again, it always depends on that patient. But I will say that usually in a situation where it's somebody can't breathe, or like it's a shortness of breath, usually, especially depending on when in that process it happens, they usually start to get anxious. So you usually have to be like, okay, calm down. If you calm down, actually, hold on. Let me see what somebody says. Respiratory rate 28. I was just about to say, actually, that respiratory rate being 28 lets you know that they're breathing fast. They're hyperventilating. That could either be because, that's really the rate that their body's trying to get to, so they can compensate for the lack of, gas exchange. Okay. But that respiratory rate being 28, good question. That was good. That was good, because the respiratory rate being 28 and the fact that they're starting to hyperventilate, whether that's like an emotionally charged hyperventilation or not. I would mention it, but I don't know if I would put that as a diagnosis. I don't know if I would put that as a diagnosis. Can you show the cover? Yep. That's the cover. But that is good. That is good. That's definitely one of those things where it depends on the patient. If she would have definitely said something like, am I gonna die or something? If she would have said something like that, definitely, what's the word I'm looking for? Address. Definitely address that. Okay. So that was assessment, diagnosis, goals, intervention, evaluation. You just completed a care plan. No, I'm not saying say that for this specific one. I'm saying if you would have a patient that's maybe exhibiting signs that are a little bit more indicative of anxiety, then I would address it. But if it's just like a respiratory rate being 28, anxiety is not the only thing that can cause that respiratory rate to be 28, which is why I wouldn't put it for this one, if that makes sense. Oh, okay, yeah. Gotcha. All right, so did that help to actually like create a nursing plan from start to finish based off of a real kind of case, not a real case study, but y'all see what I'm saying? Based off a case study and situations where y'all can actually look and we can all come across the same information and then draw the same conclusions, if not different ones. Remember, we just chose, even though the information is the same, we chose to go with a different nursing diagnosis. We chose to go with impaired gas exchange. That somebody else could have chosen something else too. Well, like what? What else? What's something else that they could have? Like impaired gas exchange is really good. I feel like we said it already. Once again, I would definitely go to short, like pulmonary something. Oh, impaired breathing is one, which is pretty much the same thing. Activity intolerance is good. Honestly, that was like the best one. That was just the best one. That was really good. Ineffective peripheral tissue perfusion. That's one for tissue perfusion. So yeah, those are different diagnoses that we could have went on, which would have changed the rest of the care plan. But the assessment part is going to be the same, but just the diagnosis, goals, interventions, and evaluation, that's going to be different, and it's going to be specific to that patient. Does that make sense? Okay. So yes, that went way longer than I meant it to. But I wanted to make sure that you guys really understood how to create a nursing care plan. Let me put myself back up. Boop, boop. Wait. Sorry. Hold on. Wait for it. Wait. Okay. But yeah, I just wanted to really make sure that you guys understood how to create, how to write a nursing care plan from start to finish, how to, dissect a case study or a scenario to really grab the information that you need and ignore the information that you don't. And, practice definitely makes perfect. So we just went through that. The more you practice, the more you do, the more, whether you're required to or you do it on your off time, the faster you're going to get, the better you're going to get, the more it's going to kind of come to you without you really having to think about it. Like I said, aside from like the assessments, which is going to differ for everybody, like the rest of the formula is pretty much going to be the same. It's just, it depends on how you're going to connect it. And that depends on symptoms from that patient. Okay. But yes, thank y'all so much. All right. So it's supposed to be 8:30, which once again, I went an hour over. So I'm going to, everyone that signed up for NCLEX Trick or Treat, thank you all again so much. This was the end of week 1 where we covered nursing care plans. This next week, which is it's going to start tomorrow through next Sunday, we're going to be talking about diabetes/endocrine. Okay. So make sure you are on the lookout. I'm going to email you guys the template so you guys can have your own nursing care plan template based off of the one that we did. I'm also going to attach the example of the one that we did, like already filled out, so you can kind of know how it looks, what kind of lingo to use. Okay, so just be on the lookout to your email inbox, updates and promotion folders, just in case you have Gmail accounts, because that's where sometimes it makes mine go. But just be on the lookout for that. I will post a story, at least letting y'all know that, hey, I sent out an email, check it. And I will also give you guys next week's instructions at a later date this week. All right, so everything that we talked about this week for nursing care plans, like I said, I'm going to gather that up for anyone that maybe missed it and want to review and attach this video to it. And if y'all have any questions, like I said, make sure you send me an email at support@thenursam.com or hit me up on that other app that starts with an I. Okay, but any live that we're going to do is now going to be on TikTok. So make sure you are subscribed to my TikTok live. All right. It's very new, literally as of yesterday. So we're going to do all our lives here. So make sure you, once again, subscribe. It doesn't cost anything to subscribe. you get like a special badge and all these cool things. But go ahead and subscribe, and I will keep you guys up to date and in the loop as far as our next week topic, which is going to be on diabetes. What about diabetes? I'll let you guys know. Okay. All right. Thank y'all so much, and I will see y'all later. Have a good one.